Bismillahirrahmanirrahim. Quote for the day is: If you are grateful, I will certainly give you more. The topic for today's presentation is diabetes mellitus. I am Dr. Ayesha Amin, PGR of FCPS Community Medicine at Institute of Public Health, and I will be presenting this under the kind supervision of my supervisor, Professor Dr. Saira Afzal. The learning outlines for today's presentation is introduction of diabetes mellitus, classification of diabetes, epidemiology, diagnosis of diabetes and management, its prevention, and multiple choice questions. The learning outcome. By the end of this presentation, the participants will be able to describe diabetes mellitus, its epidemiology, types, screening of diabetes, and prevention, and to be able to answer the MCQs. Introduction. So, diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood glucose. Hyperglycemia, which is also called as raised blood sugar or raised blood glucose, is a common effect of uncontrolled diabetes, and over the time it leads to serious damage to many of the body system, especially the nerves and blood vessels. Classification of diabetes. Diabetes is broadly classified into type 1 diabetes mellitus, type 2 diabetes mellitus, and gestational diabetes mellitus. Type 1 diabetes mellitus, which is also known as insulin dependent diabetes mellitus, and it was previously known as juvenile or childhood onset diabetes mellitus. It is characterized by the relative or absolute deficiency of insulin production, and it requires daily administration of insulin. The causes of type 1 diabetes mellitus is a hereditary predisposition, autoimmune diseases, which leads to the autoimmune destruction of the beta cell of pancreas, viruses and infections, autoimmune destructions of the beta cell, damage or removal of the pancreas, unfavorable environmental factors, drugs and chemical toxins, and endocrine diseases. The symptoms of type 1 diabetes mellitus in adults and children. The common symptoms of diabetes is excessive thirst, which is polydipsia, excessive hunger, which is polyphagia, uh, unexplained weight loss, blood vision, slow healing of cuts and sores, fatigue, vaginal yeast infection due to the suppression of immunity, and frequent urination, which is known as polyuria. Type 2 diabetes mellitus, it is characterized by the resistance of body cell to use insulin. And the type 2 diabetes mellitus, the insulin is produced by the beta cells of pancreas, but the cells, they are resistant to receive the receptor. Basically, they get resistant to use the take the to use the insulin, and it stops the body from using insulin properly, which can lead to the high levels of blood sugar. The common risk factors for type 2 diabetes mellitus is fatty liver, medication or hormonal disease, increased lipid levels, obesity, unhealthy diet, lack of physical exercise, depression, gestational diabetes mellitus, type 2 diabetes mellitus in family, old age, high blood pressure, smoking, and alcohol consumption. So, how type 2 affects the body? It leads to confused thinking, dry mouth, wounds heal slowly. There is burning or tingling sensation in hands or feet, irritability, feeling hungry, fatigue, unintentional weight loss, urinating excessively, inflamed or red gums, feeling very thirsty. The polyuria, polyphagia, and polydipsia are the symptoms that occur both in type 1 and type 2 diabetes mellitus. So, the key differences in type 1 and type 2 diabetes mellitus is that type 1 diabetes mellitus has juvenile onset. It is autoimmune or the genetic causes. There are no non-functional pancreas or there is no insulin produced. It cannot be prevented and it cannot be reversed. While the type 2 diabetes mellitus has usually occur in adults, it is characterized by the insulin resistance due to obesity or aging. There are partially functioning pancreas. Some insulin is being produced in the body, and it can be prevented through lifestyle changes, and it can be reversed with early diagnosis. The common symptoms of both type 1 and type 2 diabetes mellitus is polydipsia, polyuria, polyphagia, and blurry vision, and they require a healthy lifestyle modification and medical supervision. If left untreated, they both can lead to complications. Coming to the gestational diabetes mellitus is hyperglycemia or raised blood glucose values above normal but below those which are diagnostic of diabetes, and they typically occur during pregnancy. So the gestational diabetes mellitus, it leads to the vast complication. It leads to type 2 diabetes mellitus, hyperglycemia in pregnancy. There is predisposition to preeclampsia, macrosmia, and cesarean deliveries. Also, it leads to reproductive disorders, breast cancer, maternal depression, neonatal jaundice, and ovarian dysfunctions. Coming to the epidemiology of diabetes mellitus, according to WHO, in 2022, 4% of adult age 18 years and older were living with diabetes, an increase from 7% in 1990. More than 59% of adults aged 30 years and over living with diabetes were not taking medication for their diabetes in 2022. Diabetes treatment coverage was lowest in low and middle income countries. This graph shows the share of people with diabetes in 2024. We can see uh, here that the South Asia contributes to about 10.72% of the people with diabetes, while the highest burden is found in North American and Latin American countries, where the percentage is 13.4 to 11.31%. This is the prevalence. The graph is showing the prevalence of diabetes in Pakistan. We can see that Pakistan is shown by this maroon color, which shows that there are the percentage of the people with the diabetes is more than 20%. So prevalence of diabetes in Pakistan is around 31.4%, and it has drastically increased over the past years. This graph is showing the trends of diabetes and death from the diabetes by type 2 and type 1, and we can see that this graph, the upper part of the graph is showing the trends in the world. We can see that in 2021 about 1.6 million deaths were occurred due to diabetes, and in Pakistan in 2021 around 40,000 deaths were reported due to diabetes mellitus, and the share of uh, 47,000 deaths were reported due to type diabetes mellitus, and the share of type 2 diabetes mellitus was major. It was around 44,000 deaths that were reported due to type 2 diabetes mellitus. The screening and diagnosis following tests are performed for diabetes mellitus, that is urinary glucose, fasting blood glucose level, random blood glucose levels, glycosylated hemoglobins, that is HbA1c, and oral glucose tolerance test, that is OGTT. So, the HbA1c test is measure the average blood glucose of the past 2 to 3 months, and it has these ranges. If the HbA1c level is less than 0.7%, it is considered as normal, while the levels of 5.7 to 6.5 are considered at pre-diabetic, and levels greater than 6.5% are described as patient with diabetes. The stats are taken, these are the guidelines from the American Diabetic Association, and the reference is given at the end. While the fasting plasma glucose is usually done when the patient is asked to not eat anything except water for at least 8 hours, and then the test is usually done in the morning before breakfast. So the normal fasting plasma glucose level of less than 100 milligram per dl are taken as normal, while the levels with between 100 and 126 milligram per dl are taken as pre-diabetic, while levels greater than 126 mg per dl are considered to be diabetic. The random blood sugar, the test is a blood check at any time of the day, and the diabetes is diagnosed at a blood sugar of greater than or equal to 200 mg per dl. Coming to the oral glucose tolerance test, the OGTT is a 2-hour test that checks your blood glucose level before and 2 hours after you drink a 75-gram glucose drink. It tells your it tells how your body processes sugar. So if after 2 hours the blood glucose comes out to be less than 140 mg per dl, it is considered as normal. While if it comes out between 140 to 200 milligrams per dl, it is considered at pre-diabetic, and whilst level greater than 200 are considered as diabetic. The other tests which are usually performed for these patients are urine complete examination, which is usually basically done for microalbuminuria, renal function test, which includes creatinine and urea, fasting lipid profile, eye examination, retinoscopy, and echocardiography. Management of diabetes mellitus is usually revolves around lifestyle modification, oral hypoglycemic agent, and insulin therapy. The lifestyle modification includes, first of all, the patient should have healthy eating habits. He should do regular physical activity. The blood sugar monitoring is very important. The patient should stay hydrated. The medication adherence or compliance to medication is also very important. Then the patient should be encouraged to maintain the ideal weight. Stress management should be done, and patient should avoid smoking and consumption of alcohol. For drug therapy, there are oral hypoglycemic agent. There are certain class of anti-diabetic drugs which are used. The most commonly used are biguanides, which is metformin, and then there are first generation and second generation sulfonylureas. Then there are meglitinides, thiazolidino thiazolidinediones, alpha glucosidase inhibitor, incretin agonist, and TPP4 inhibitors. And the insulin therapy, there are certain types of insulin. There are different preparations which include soluble insulin, which is plain insulin. Then there is rapid acting insulin analogs, which includes lispro insulin and aspart insulin. And then there are prolonged acting insulins, which include protamine insulin, zinc insulin, and glargine. The major complication of diabetes, that diabetes has a wide range of macrovascular and microvascular complications. The macrovascular complications, they affect the brain, heart, and extremities. In brain, they increase the risk of stroke and cerebrovascular diseases, including transient ischemic attack, cognitive impairment. In heart, it leads to high blood pressure, and insulin resistance increases the risk of coronary heart diseases. Extremities, peripheral vascular diseases result from narrowing of blood pressure, blood vessel, increasing the risk or reduced or lack of blood flow in legs. The wounds are likely to heal slowly, contributing to gangrene and other complications, while microvascular complications mainly affect the eye, kidney. In eye, the high blood glucose and high blood pressure can damage eye blood vessel, causing retinopathy, cataract, and glaucoma. In kidney, the high blood pressure damages small blood vessel, and excess blood glucose overworks the kidney, resulting in nephropathy and neuropathy. Hyperglycemia damages nerve in the peripheral nervous system. This may result in pain or numbness. The feet wounds may go undetected, get infected, and lead to gangrene. Prevention, there are 4 levels of prevention: the primordial prevention, primary prevention, secondary prevention, and tertiary prevention. As we all know, the primordial prevention, it is basically done to includes the healthy life habits in at the very young age, which can include if we should encourage our children to provide to prevent childhood obesity. We should encourage them to walk and do physical activities like swimming and walking and cycling. And we should encourage them to eat healthy, and we should provide them with the safe and healthy lunch. The primary prevention, the focus of primary prevention of diabetes is on the lifestyle modification, making healthy choices in diet, maintain a healthy weight, monitor blood sugars regularly, adequate quality sleep, stress management should be done, and again limit alcohol and quit smoking, and regular health checkups. The diet chart for a diabetic patient should include whole grains, vegetables, protein source, healthy fats, and fruits, while he should avoid refined grains, sugary foods, high fat dairy products, fried foods or processed foods, and excessive salts. The secondary prevention is usually done includes the screening of high risk individual which has the family history of the diabetes, or they have the genetic predisposition for the diabetes, then adherence to treatment, maintain good glycemic control, maintain ideal weight, blood pressure monitoring, and periodic health checkup to prevent complications. The tertiary prevention, it includes screening for the eye problems to avoid retinopathy, screening for renal problems, and foot care. This is the WHO initiative, which is known as the Global Diabetes Compact. In April 2021, WHO launched the Global Diabetes Compact, a global initiative aiming for sustained improvement in diabetes prevention and care, with a particular focus on supporting low and middle income countries, as there was very low treatment coverage in low and middle income countries, and a higher number of deaths were reported there. There is a globally agreed target to halt the rise in diabetes and obesity by 2025. The vision of the Global Diabetes Compact is the WHO Global Diabetes Compact has the vision of reducing the risk of diabetes and ensuring that all people who are diagnosed with diabetes have access to equitable, comprehensive, affordable, and quality treatment and care. The work undertaken as part of the compact will also support the prevention of type 2 diabetes from obesity, unhealthy diet, and physical inactivity. These are the engagement structure of the Global Diabetes Compact. It includes WHO Global Diabetes Compact platform, a platform to share information and advocate for a world where the risk of diabetes is reduced and all people with the diabetes have access to care. People living with the diabetes at decision-making tables to ensure work undertaken is focused on the areas where action is most needed, engaging the private sector, dialogue to encourage effective and meaningful contribution to national response for the prevention, diagnosis, and management of disease. Then health and technical advisory group on diabetes, and advisory body to WHO on strategic and technical matters related to diabetes, and then engagement of the region and member states, providing technical guidance and other forums of support for the advocacy effort of policymakers, civil society, academia, and private sectors. The WHO initiated the first ever global coverage targets for the diabetes adopted at the 75th World Health Assembly. It has 5 targets, and it should the idea is that these 5 targets, they should be achieved by 2030. And the targets are that 80% of the people with diabetes, they are diagnosed. Then 80% of people who are diagnosed with diabetes have good control of glycemia. 80% of the people with diagnosed diabetes have a good control of blood pressure. 60% of people with diabetes of 40 years or older receive statins, and 100% of people with type 1 diabetes have access to affordable insulin and blood glucose self-monitoring. These targets are to be achieved by 2030 by every country. So World Diabetes Day, it is celebrated on 14th of November. Coming to the multiple choice question, the first question is: a 19-year-old female presented in outpatient department with
Would you please listen to my feedback first before going to MCQs? Number first, if you go to your slide where you have classified diabetes, please go to that slide.
Yes, ma'am.
In future, before MCQs, I will give you my feedback. So that there are 2 sessions. One would be about the presentation, and other is about the MCQs. The MCQs, I have given you the written instructions how to make good MCQ. Everyone should follow it. There should be no double negatives. There should not be any vowels or grammatical clues. There should not be the heterogeneous distractors. All the distractors should be homogeneous. The correct answer should not stand out. So I have already given the detailed feedback and write in writing, and already shared in the group. As far as the classification of diabetes is concerned, it is very important from the preventive point of view that we correctly classify diabetes. Diabetes type 1, type 2, gestational, and we also have the secondary diabetes, and we have the maturity onset diabetes of the young. especially in areas in the East and Pakistan and Southeast Asia. It is very important type where the young people are suffering from diabetes type 2, and they are actually not the people who are in the classification as given by UK and USA on diabetes. So it is more towards the east. So whenever we do the screening, the two important types have been missed out, and they are very important from the point of view of prevention. One is the secondary diabetes. In our country, we know there are many people who have steroids. They are given certain type of injections that is called iatrogenic diabetes. So iatrogenic diabetes is another important type of secondary diabetes. So you must add secondary diabetes, and the second thing should be the MODY, maturity onset diabetes of the young. The screening of the young people for diabetes is essential part of any healthcare systems, healthcare services for diabetes. So it has been missed totally from your slides. So please add these slides, and now you can go further for MCQ session.
Thank you, ma'am. So the first MCQ is a 19-year-old female presented in the outpatient department with the symptoms of extreme thirst, increased hunger, dry mouth, frequent urination, and unexplained weight loss from the last 2 months. She reported a prior history of diabetes diagnosis 1 year ago, managed with diet control. She reports fasting blood glucose in the 150 to 230 mg per DL range most days. She checks her blood glucose before breakfast occasionally and report glucose usually over 200 milligrams per dl. Most likely cause of these symptoms are due to a gestational diabetes, b malnutrition induced diabetes, c steroid induced diabetes, d type 1 diabetes mellitus, and e is type 2 diabetes mellitus.
E.
No, the right answer is d type 1 diabetes mellitus. The second MCQ is a 50-year-old man with poorly controlled diabetes develop a painless non-healing ulcer on the plantar surface of his foot. The sensation is reduced. Which factor most likely contribute to this ulcer? A. Peripheral neuropathy and ischemia. B. Deep vein thrombosis. C. Vitamin C deficiency. D. Fungal infection. E. Drug reaction.
Alpha. A.
Yes, A is the right answer. 3. A 25-year-old, 28-week pregnant female presented in the gynecological and outpatient department with the symptoms of increased thirst, fatigue, and increased urination for last 1 month. She gave a positive family history of diabetes. The most likely cause of this symptom is due to A. Gestational diabetes, B. Pre-diabetes, C. Steroid-induced diabetes, D. Type 1 diabetes, E. Type 2 diabetes.
Alpha.
Yes, A is the right answer. Gestational diabetes. MCQ 4. Mr. Ali, a 50-year-old male, has had diabetes mellitus for the past 10 years. His glycosylated hemoglobin is 8%, and he is on oral diabetic medications. Upon his recent routine checkup in the endocrinology clinic, the physician advised him to exercise, maintain his weight, foot care, and regularly walk. Which of the following type of diabetes in which primary prevention has limited scope? A. Gestational diabetes, B. Malnutrition induced diabetes, C. Steroid induced diabetes, D. Type 1 diabetes, E. Type 2 diabetes.
D. Delta.
Yes, D is the right answer. 5. A community health survey in an urban population shows that 14% of adults have diabetes and 9% are unaware of their diagnosis. What is the most appropriate public health action to reduce the burden of undiagnosed diabetes? A. Increase tertiary care hospital. B. Introduce population-wide glucose screening campaigns. C. Screen only symptomatic individual. D. Focus on insulin distribution. E. Restrict carbohydrate intake by law.
Charlie.
No, B is the right answer. B is the right answer. Introduce population-wide glucose and glucose screening campaigns. Six, in a low resource district, 30% of diabetic populations patients they do not adhere to treatment due to cost and poor access to care. What public health approach would most effectively address this issue? A, subsidize essential anti-diabetic medicines through government program. B, conduct more awareness campaigns. C, increase private clinic licensing. D, encourage traditional healers to manage diabetes. E, implement a sugar-free diet.
B.
Um, the right answer is A, subsidize essential anti-diabetic medicine through government programs. Because the people are not adhering to treatment due to the poor access to care and due to the cost of medicine. 7. A 45-year-old male presented in the outpatient department with the symptoms of tingling and numbness in the feet, leg cramps, weight gain, extreme thirst, increased hunger, dry mouth, frequent urination from the last 2 years. He reported a positive family history of diabetes. He recently shows report of fasting glucose in the range of 230 milligram per dl and HbA1c is 8%. Most likely cause of the symptom is due to A, gestational diabetes, B, pre-diabetes, C, steroid-induced diabetes, D, type 1 diabetes, E, type 2 diabetes.
E.
Yes, E is the right answer. And the MCQ number 8, a population-based intervention aimed to reduce diabetes incidence by building safe walking tracks, restricting junk food advertising near schools, and promoting healthy canteen menus. This represent which level of prevention? A, primordial, B, primary, C, secondary, D, tertiary, E, none of the above.
A.
Yes, A is the right answer. The MCQ number 9, Mr. Ahmed wants to conduct a population-based study to determine the prevalence of diabetes mellitus type 2 in the ABC population. The screening test is recommended at best for epidemiological surveys is A, blood urea, B, glycosylated hemoglobin, C, lipid profile, D, 2R value after 75 gram oral glucose, and E, urine examination.
D.
Yes, D is
Beta.
the right. Yes, D is the right answer because OGTT is considered as a screening test, while glycosylated hemoglobin is usually used for the purpose of diagnosis. The last MCQ is during a primary care clinic audit, only 40% of diabetic patients have controlled HbA1c level. Which is the best public health strategy to improve glycemic control in the community? A, provide free glucometers. B, conduct health education and self-management programs. C, open more tertiary care hospitals. D, provide insulin to all patients. E, annual screening for complications only.
Beta.
Yes,
B.
B is the right answer. Conduct health education and self-management programs. This is the key to MCQs. These are
MCQ.
these are the references which are used in the presentation.
So would you please go to your MCQ number 8? So what is the correction that is required in this MCQ?
Uh,
Anybody from the class?
yes, ma'am. Ma'am, I think I should have not mentioned the option E as none of the above.
Okay, very nice. Another correction?
Mm.
Any other correction from the class?
Madam, sequence should be different in case like secondary or primordial and mix होना चाहिए था. There should be mixing of the options.
Okay, very nice. So these are correct observations. Number first, the scenario that is a good scenario. It is a problem-based scenario. The good thing is that the scenario that has been made, it is very nicely made. However, the scenario is more from the point of view of advertising near schools. So if we are talking about diabetes, then we are making not only the schools as the center point, it should be near markets, near social places, and schools. So, why only schools have been highlighted?
Uh, Ma'am, the point was like
Mostly, most
the
of
children
the
are going towards the school. So yes, it should be like as in everywhere. We should like on social media, on TV screens, and in ads. We should restrict the use of junk foods and its advertisement. We
very
should.
good. So, you should reframe this question restricting junk food advertising on social media, because
Yeah.
most of the population who wants to know about diabetes, they would not only be in schools, it would be everywhere.
Yeah.
So these are the two observations, that E should be removed and it should be replaced with some other homogeneous option. And second, the intervention, when you are talking about the intervention, it is very important to target the population where maximum people get benefit out of it. So
Right.
these are my observations. So thank you very much, everyone. And I hope that after correcting two important points, one is about the secondary diabetes, second about the maturity onset diabetes of the young, that is called MODI. Please share this again on in the group. However, this presentation as such should be available on YouTube channel. Thank you.
Thank you. So this is the key to MCQs. These are the references which are used in my presentation, and this is our the official YouTube channel of Institute of Public Health where this presentation would be uploaded. And thank you.